Mannheimer, I'm Mayor of the City of Asheville, and I'm pleased to convene along with the Chair of the County Commission, Brownie Newman, this joint meeting of the City Council and County Commission. I'm just going to make some brief opening remarks here. First, we want to reiterate our appreciation to the Dogwood Health Trust for their generous grant that paid for the National Alliance to End Homelessness study to develop a needs assessment for our community. And we were provided with the recommendations from the National Alliance to End Homelessness last year, well, not last year, we're still in the same year technically. So it was January 2023 where we sat in this room and heard those recommendations around needs related to our community response to unsheltered homelessness. So today we're here to hear what progress has been made since that time. And we know that this is a challenge not just for our city and our county, but our entire community. And I want to take a moment to thank all of our partners in this community that have been working so hard on this issue. And I know some of you are here in this room with us, so thank you for joining us today. Some of you may be watching, and some of you are out there doing the work right now. So you're not able to be here, and we appreciate you very much for that. So one of the things that precipitated the decision to engage the National Alliance to End Homelessness to do a study for our community was a discussion we were having, was a discussion we were having in our community around the need for additional shelter and what types of additional shelter we needed. So I was very pleased to be a part of a working group that worked on our shelter needs in our community. We toured all the shelters in our community. We heard from a lot of providers. We did a lot of deep dive work in that, and the city and county just recently funded bringing online 43 additional shelter beds for our community. And that is an accomplishment. It is only about half of the goal of what the National Alliance to End Homelessness recommended for our community. So obviously more work needs to be done, and that's part of why we're sitting here today. And we also, since the last time we met, both bodies were supportive of of Homeward Bound and other entities working to bring on additional permanent, affordable units that are permanent supportive housing units. So we now have Homeward Bound's Compass Point with 87 units of permanent supportive housing. So we've made some progress, but we're here to hear more about what else we have done and what else needs to be done. So I'm looking forward to this discussion and how we as a community can maximize the impact on this challenging issue in Asheville and Buncombe County. And to hear how we progress through the recommendations made by the National Alliance to End Homelessness. And just one final note, we as a city council have voted to unanimously support implementing the recommendations of the National Alliance to End Homelessness. That was another milestone that we hit this year. So.
All right, good morning. Thank you, Mayor. My name is Brownie Newman, and on behalf of the Buncombe County Commissioners, I want to thank everyone for taking time to participate in this joint meeting between the city and the county to address homelessness in our community. As the mayor said, this meeting is a follow-up to our meeting in January, where we received a report from the National Alliance to End Homelessness. There has been significant progress made since we last convened, including the county's hiring a dedicated staff to focus on youth and support efforts, and we're happy to welcome Lacey Doyle to the county team. Our work together has resulted in adoption and approval of plans and associated budgetary resources to maintain 45 shelter beds and create 43 additional shelter beds in our community. These will provide important spaces for individuals and families as we work together to plan for the creation of expanded permanent shelter facilities. One of our key takeaways is the importance of working together. This has led to increased coordination of services, such as the county's community paramedics program and city and county staff working together to move forward with the study's recommendations. New supportive housing is coming online through Compass Point, which the city and county and other partners have supported financially, ABCCM, and Step Up. Together, these new facilities will provide significant new dedicated permanent supportive housing units focused for people who have experienced chronic homelessness in Asheville and Buncombe County, and they are the result of many years of work from many partners in the community. Looking forward, we are already starting to work towards a new shelter that will help us close the shelter bed gap. This shelter will have co-located services to support individuals as they move forward toward permanent housing and stability. Since we last met, the county has also moved through the first year of allocating funds from the voter-approved affordable housing bonds. We recognize that the scarcity of affordable housing in our community is the largest single driver in the homelessness crisis that we face, and is also a fundamental issue facing workers in our community, where rents and home prices have significantly outpaced wage increases. We've also been pleased to see how the passage of the affordable housing bonds has resulted in a robust pipeline of new affordable and workforce housing being proposed from builders in our community. In this first year, the county has been able to dedicate about $15 million of the bond funds, which is expected to leverage more than $75 million in total investment to build more than 300 new affordable homes and apartments in our community. We have a great deal of work to do to meet our ambitious affordable housing goals, but we're off to a strong start. And as with the efforts around addressing homelessness, we appreciate the many partners that we are working with, including Asheville, as we work together to scale up the development of more greatly needed affordable housing in our community. So thank you all again for all who have taken time to join us this morning, and we look forward to the discussion and working together on the implementation of the plan.
All right, next we're going to hear from Emily Ball, our Homeless Strategy Division Manager with the City of Asheville.
Good morning.
I don't think yours is on yet.
It will suddenly go up.
Well, yeah, it will be a surprise. There you go.
Great. Good morning. Thank you all so much for being here. Thanks for your time and dedication to this issue, and I appreciate your attention and your time on this Monday morning. We only have 97 slides. Great morning. But we have done a lot of work on homelessness response over the past year since we got the recommendations from the Alliance in January, and so I'm glad to be with you this morning to share what some of that has looked like. Quick overview of our agenda this morning. We're going to start with some background on that project with the National Alliance to End Homelessness and the comprehensive recommendations that they delivered in January in this room, January of this year. Those recommendations were really anchored in the continuum of care framework, so we're going to do a brief refresher on what that framework looks like. Excuse me, and then we'll move into what the key progress on implementation in all 5 of the Alliance strategies has been. The list here is not those strategies, but it is some of the highlights of our implementation. So rebuilding the continuum of care, working on training, outreach and encampments, coordinated entry, engaging folks with lived experience, some of whom are in the room today, expanding emergency shelter, both in the immediate and long-term planning, and then looking at data improvements and permanent housing expansion. And then we'll wrap up with some next steps and discussion. You all have at the table, you have a printout of all of the recommendations that we got from the Alliance with specific status updates on each of those. There were 112, so we're not going to go through all of those this morning, but you do have that as a reference. And I'll also say that we have built in opportunity for questions and discussion at the end of each agenda section and at the end of each strategy. So background. We know that the pandemic resulted in a significant increase in unsheltered homelessness in our community. That's partly related to a decrease in services. You know, folks were trying to comply with CDC requirements and really had a lot of immediate safety concerns in the beginning, so some of those services were decreased. At the same time, the need was increasing significantly, and rental housing costs rose almost 42% during the pandemic. That's a shocking number, and we know from national research that the #1 indicator of rates of homelessness in any community is housing costs. So as those housing costs increased dramatically during the pandemic, it is not a surprise that we also saw an increase in unsheltered homelessness. As a result, Dogwood Help Trust funded the Alliance to conduct a needs assessment and to provide recommendations to our community to improve our overall response. And again, those recommendations were anchored in the continuum of care structure. What we saw in the pandemic is that communities that had really effective response to homelessness during the pandemic had really well-developed continuum of care, or COC, really well-developed COCs. In our community, however, the pandemic exposed some pre-existing problems in our COC structure. So we got a number of recommendations from the Alliance around restructuring our COC. Brief background on what the COC is. Because responding to homelessness requires many independent organizations and systems to work together, the federal government designed the Continuum of Care program as a framework for collaboration and system. The Homeless Coalition has existed here for decades and has been, I would say, an informal picture of what a continuum of care membership body is intended to be, but we've never had that formalized membership body. The second component is a continuum of care board. That is the leadership body governing the COC with strategic direction, policy, and resource allocation. In our community, that is the Homeless Initiative Advisory Committee, or HIAC, which is jointly appointed by you all at the city and the county. And then the third component is a lead agency, and that's an entity designated by the board to provide infrastructure and support. So in our community, that is the city of Asheville, and that's the role of our team in the Homeless Strategy Division. Implementation of recommendations. As the current Continuum of Care Board, HIAC has really been in the driver's seat on implementation. They have taken a number of actions. First, they adopted the recommended goal from the Alliance of decreasing unsheltered homelessness by 50% by the 2025 point-in-time count. They adopted the identified community values, and then they also prioritized the recommendations, again, 112 recommendations. They also prioritized those for focus areas in 2023 for implementation. Part of that looked like establishing work groups to implement those prioritized recommendations. I want to really highlight that we've had widespread engagement across our community across many concurrent efforts. We had 36 work group members who contributed over 5,600 combined hours into implementation. That's a tremendous amount of community energy and attention and effort and just time. So I really appreciate the folks, a number of whom are in this room, appreciate the folks who participated in this implementation process. For me, the Alliance project has really catalyzed a lot of community action. Again, we have a lot of enthusiasm and engagement around this. The recommendations from the Alliance fell into 5 primary buckets. So these are 5 strategies that each had associated priorities and action steps. The 5 strategies are to create a strong foundation, meaning establishing a systems-level planning and coordination framework and approach. To implement evidence-based and inclusive policy, that's really about building up our homelessness response system. To improve system performance through program design, which is about improving the performance of that response system. We know whether or not the system is performing based on the data that we have, so improving data quality and reporting.
and then investing in the future to increase the access to and production of permanent housing solutions. So our agenda today will follow the arc of these 5 strategies, and we'll report out progress in each of these. Any questions?
Actually, I do have a question. Can you go back to the previous? So number 2 has always stood out to me because it discusses creating an equitable, person-centered response system. And I've recognized that what we're dealing with is for unsheltered homelessness. But I do remember a few years ago at a meeting at the Asheville Housing Authority, there was data presented that explained reasons why people find themselves in that state. And for people of color in particular, the main driver and often the only driver of finding oneself unhoused was poverty. But for people who are not of color, it was primarily poverty in addition to mental health issues or addiction issues. And keeping in mind that the stereotype that everyone who's homeless is the wrong stereotype, that everyone who is homeless is addicted or has mental health issues. I do find it troubling that when we discuss chronic homelessness, in order to qualify, one has to have a diagnosable disability, which is often addiction issues or, and this is the longest line-up to a question ever. If people of color are more likely than not to be homeless based on poverty alone, and we're implementing processes that deal with chronic homelessness, how do we actually ever get to a place where number 2 is even possible? In other words, what programs do we have available to people who are unhoused, who are not, who do not have addiction issues or do not have mental health issues?
Great casual question to start the morning. No, that's a great question. I think one thing that I love about that is when we issued the RFP and ended up working with the Alliance on this project, it was really specific to that increase in unsheltered homelessness in the pandemic. And what the Alliance gave us back was much broader than that. They said, you know, of course you have an increase in unsheltered homelessness and we need to respond to that, but that happens within the context of your overall response to homelessness, which includes folks who are chronic and includes folks who are not chronic. And your system as a whole is not working. And so we need this comprehensive realignment of our governance and also the mix of services available in our community so that they better and better match the needs of people who are homeless. And in order to do that, we have to understand who those people are and what their particular needs are, which means we have to have improved data compared to the data that the Alliance was able to work with. So I guess my own answer to your question would be that one of the recommendations we got from the Alliance was a targeted universalism approach, meaning let's understand all of the populations who are homeless in our community and develop specific strategies for them to get everyone up to this equitable baseline of permanent housing. We want 0 people in our community to be homeless, and we know that different people need different interventions and different pathways in order to get to that point. So I would say that we're not, at this moment in time, we do have a number of, we have rapid rehousing happening, which is not specific to folks who are chronic. We have homelessness prevention and diversion activities. We have a number of activities happening, but we certainly have a lot of opportunity in order to build that equitable system.
Can I ask a follow-up, but also just say thank you, Antoinette, for that important question and centering. I don't see any time on our agenda where we are going to maybe hear from someone with lived experience, so there are people in the room. We don't have public comment scheduled. So that said, I had some similar questions, and priority 1C says that we're going to ensure that equity is centered, and 1H, people with lived experience should have a voice in all phases of solving homelessness. And 2B, ensure meaningful participation and compensation of people with lived experience. And I think that might help us get to a greater understanding, is if people can be at decision-making tables around our budget plans and policies. So I'm thinking well about some of the lessons learned as we approach today, and I have submitted recommendations from members of HIAC, requests for compensation, and I haven't gotten a meaningful response yet, but I'm hoping as we strive for these goals and these adopted strategies, that we can prepare a response to this compensation part. A stipend, most closely familiar to us, would be the Community Reparations Commission, where we provide stipends so people with lived experience can be at the table. Another example would be Durham provides stipends for their board and commission members so that people can use that stipend for transportation or childcare or time away from work. While so many people at the table are compensated through their salaries to be at the table, I think we might be hamstringing ourselves in getting to our goals if we don't address the inequities in our community and the people who are showing up. So it's a way to, I think, honor the people who've volunteered countless hours of consulting time to get us to the place we are today, but I also don't think we're going to get where we want to go without people with lived experience at the table. So I just wanted to name that too.
Councilwoman Roney, I appreciate that comment. That does bring me to a question. We each have at our seats the NC 501 Asheville Buncombe Continuum of Care Draft Governance Charter, which does address the issue of compensation. So Emily, is this draft charter the recommendation of the COC subcommittee of HIAC, who was assigned to work on this? So this is their recommendation regarding the full governance structure, the makeup of it's got the makeup of the new COC, and it does address the issue of compensation. So
It speaks to it, but it doesn't speak to what we've just dealt with this year. Was we said at the beginning of this process, we need people with lived experience. And then they showed up and they showed up and they showed up, and we don't have an answer for the time that has been spent.
I appreciate that. I guess one of the things that is a little bit interesting here, if I understand the National Alliance to End Homelessness recommendations, is that we're kind of launching a COC to be an independent body, making its own recommendations and decisions, not for us as a council or a commission to override. So while I think we could generate all kinds of ideas, I want to honor the governing structure that I think we're supposed to be moving into. So this would be, that topic as well as many other topics would be under their authority to make recommendations around. Now, if they decided that they wanted everyone to be compensated or only certain folks to be compensated and they needed a source, which it mentions in here, then I assume that will probably come to us or us in the county or for those monies. But I'm just trying to understand that I think we all have such good intentions and good ideas, but that fundamentally we're supposed to be moving to a structure where the COC is a self-governing entity, right? So.
That's right. And, we have recommendations from the Alliance that speak to all of that. And I would tell you that we're here today to talk about progress that we've made, but we're certainly not here to say that we've gotten it all done. And I think that part of the new charter, which we're going to really unpack in the next section, just sets the path for how we can do that kind of work together in the future. All right. Key progress on implementation. So strategy 1, I'll forecast for you that strategies 1 and 3 are the sections where we have had the most effort and intention and the most action taken. So those are our densest agenda sections today. Strategy 1 is all about restructuring the continuum of care. So creating a strong foundation, supporting systems level planning and coordination. Key takeaways on our implementation of Strategy 1, restructuring our COC was the #1 priority identified by the National Alliance to End Homelessness. Like literally priority 1A was about restructuring our continuum of care and has been a primary focus of our community's implementation efforts. Almost all of the recommendations, all of the action steps in Strategy 1 are either completed or addressed by the new COC charter and the process that's underway to make that transition now. it is critical for us as a community, and I say that to both elected bodies, but really to our wider community. It is critical for us to invest in this strategy now. Many of the recommendations that in the other 4 strategies are contingent on having that COC restructured. And I would also say progress takes widespread participation. Our community is engaged with great momentum, and COCs are participatory bodies, and so they can only be as effective as the quantity of participation that we have across the community and the quality of participation that we have across the community. So that certainly includes the city and county, but is not limited to the city and county. 8 priorities, 32 action steps, heavy lift in this first strategy from the Alliance. So the first recommendation, I'm going to read this because it's very important. Improve system governance by creating and implementing a new COC structure to guide community-wide planning to reduce and end homelessness. This structure includes collaborative partners, systems of care, and people with lived experience. Again, no single entity manages all of the pieces that are essential for the work in responding to homelessness. So the COC structure is intended to bring all of those pieces together. A high-performing continuum of care really is an ecosystem of homelessness response. So that includes a lot of moving parts, including a coordinated system of services. So the goal, this is important, the goal is not to end homelessness, but to establish a system that effectively resolves every individual occurrence of homelessness. So to be clear, you can't show me a person in Buncombe County who I don't think we can come up with a housing solution for. I'm not suggesting that there are people who choose to be homeless or that people will always need to be homeless. I am suggesting that in the past when we've had, we had the 10-year plan to end homelessness, that was a national move. I think that kind of language has really confused a lot of people about what the work is and what our objectives are. For me, the objective is to build a system that's very good at responding to homelessness anytime that someone experiences it. People are always going to have housing crises. All of us in this room are going to have a next crisis in life, and people are always going to have housing crises. What we need is a system that's effective and able to respond when that crisis occurs. I think of this as being very similar to a healthcare system. So it doesn't matter if we get very good at prevention, very good at early detection, very good at primary care, et cetera. We're always going to need that emergency room because emergencies happen in our lives. Very similar situation with the homelessness system. That ecosystem of homelessness response should center people experiencing homelessness. So much like patient-centered care in a healthcare system, we need to always keep at the forefront that we're just talking about human beings who are in extreme crisis. That has to be the core of all of the effort. People should be surrounded with a mix of services that is coordinated into a system. So not a lot of disjointed services that may be moving in different directions, but services that work together and complement each other and that come together as a cohesive system. Those services should be shaped by committees of experts who develop and evaluate the system. So again, should be very thoughtful, very strategic, bring a lot of expertise to the table. Committees in this ecosystem are appointed by a board based on the strategy set by the board. And that board is elected by stakeholders who participate throughout. So all of these pieces work together within this ecosystem. And then the role of the lead agency is to support the infrastructure that keeps all of that in motion. Any questions about this? I'm going to go off book and ask if you have any questions. For me, this slide is really important. This is the core concept of the continuum of care. So in our community, historically, our COC structure hasn't facilitated strong results. This is certainly the input that we got from the Alliance, that we, as a community, we have lacked shared, transparent decision-making, and therefore we've lacked shared responsibility and accountability. It's been very unclear who's doing what, how people can participate, who has power, what our outcomes are, what's working, and where our opportunities are. And that we haven't had enough seats at the table, and that it wasn't clear what the table was for. So we've had a long time lack of understanding about what the COC is intended to be. And again, that intention is that the COC is the ecosystem of our collective response, not a standalone organization or operator, but a formal and collaborative planning body with administrative support from a lead agency. So our process in implementing this this strategy from the Alliance is that HIAC established a governance work group to draft a new continuum of care charter that will establish a framework for shared, transparent decision-making, responsibility, and accountability that clearly defines the scope and function and process of the COC, and that establishes roles and responsibilities of the continuum of care membership, so that large body of stakeholders, of the board, the committees, the lead agency, and the Homeless Management Information System lead, or HMIS. I think you're all familiar with this, but HMIS is the data collection system that we use in our community. Our current continuum of care has never had a charter, so we have the establishing resolution for HIAC, and we have bylaws for HIAC, but we haven't actually had a continuum of care charter, again, contributing to this just confusion about who has what role in our community. The charter that was drafted by the governance work group fulfills or creates a pathway to fulfill every recommendation in Strategy 1. So restructuring the board to move that out from the city and county structure with clear decision-making ability, identifying new board members, establishing that membership base, clarifying roles and responsibilities, forming subcommittees, developing strategy, ensuring equity, transparency, and accountability, building system and provider capacity, and developing a written process outlining how decisions are made, by whom, and how the community is engaged. The charter really is the beginning of that written process. Strategy 1 recommendations included some specificity for the city and county, so that the city should support strategies with its resources, should provide administrative support to the COC, and should continue as the lead agency. That the county should support strategies with its resources, should hire a homeless coordinator, as you have, and should deploy safety net resources through the COC. And that service providers, people with lived experience, private sector funders, and community advocates should engage in Alliance. So the big idea, which I'm going to keep hammering home, is that we want to really consolidate all of our efforts around homelessness into this unified approach. If we can get this right, then we should see significant impact in our community. This next section, we're going to walk through the charter composition, which is dense content, but represents a really pivotal shift in our response to homelessness in the community. It is essential to build this foundation so that our other efforts can be maximized. And we know that communities that have strong COCs have demonstrated strong outcomes, particularly in the pandemic. A number of people have emailed me the recent article in the New York Times about homelessness in Houston. We've seen a lot of national attention on Houston and their positive results on homelessness. And the specific, one of the specific things that Houston got right is their continuum of care structure. And that's the quote here, that one of Houston's most important innovations was to establish Coalition for the Homeless there as independent outside agency to coordinate 100 nonprofits so that they could all address homelessness under the umbrella of an effort called The Way Home. The Way Home is their continuum of care. In other cities, and this applies for our community, in other cities, organizations are well-meaning but scattered. So one homeless person may have contact with 3 nonprofits while another has contact with none. And these initiatives may not be tightly focused on getting a roof over someone's head. So our big opportunity here is to restructure the continuum of care in order to create the umbrella over that effort, bring those collective efforts into better alignment. Any questions or comments?
Just quickly, this is the most in-depth update I've seen about this, and it's just really exciting. As you noted, it is both sort of dense and wonky content, but absolutely critical as we move forward. So just want to take a moment to thank the folks who've been so diligently working on that in the 11 months since we had our last joint meeting. I've been working on the shelter side of things, but it's just really, really exciting to see this level of progress around those goals.
Thank you. I agree. I think this is one of the most impactful things that we can do in order to have long-term success in our community.
And Emily, this is Kim. I would just add a couple more things. I think what this presentation so far was missing was a visual that showed the ecosystem of the continuum of care. And when you showed that to us on the governance committee, it really added to the understanding and allowed us to really dream of where we're headed and provide some direction that doesn't jump off the page when it's just words. But I just wanted to say thank you for bringing so many people together to the table. And I know there's a lot of people in this room who've contributed time and energy, including a lot of support from people with lived experience who have informed the future of our charter. But I have another issue is Houston was brought up, and I know it would get brought up today, but I am hearing a need across the country from local municipal electeds to be careful when considering Houston's success. And here's why. Post-Hurricane Harvey in 2017, very high number of federal and emergency housing vouchers matched a high rental vacancy rate, and that was followed by additional vouchers for COVID-19 relief. Houston has a rental vacancy rate of about 9% as of July 2023, according to U.S. Census data. They also had a 2.5% rent increase last year. So our Asheville area vacancy rate is estimated to be less than half of that at 4%, and that's for the Asheville metro area. So Houston has had success in their programs because they've had federal support with vouchers that we need, and they have had landlords willing to accept our vouchers. So we're gonna have to do something about deeply affordable housing in our community to back up our plans and get folks housed.
I agree, and I mean, I would love to just share briefly so that everyone is aware that the county's been supporting an initiative called Project Thrive that does, is that what it's called? Yeah, okay. What's it?
Along with the city.
And the city, yeah, that does exactly that, around encouraging landlords to accept vouchers. So I think there are efforts underway very locally to address exactly some of those concerns that you raise, and as well as the creating as rapidly as we can the deeply affordable housing that we all know we need, both from the city and the county.
And we also just heard a report from Thrive, and it showed that the housing that we've been building isn't accessible, especially for Black and brown and working and poor people. So we have a long way to go.
Yeah, that was particular to households of four, and it's dark new data. But we also, just so y'all are aware, when the city offers incentives to developers or applicants to provide affordable housing, we have crafted language so that the incentives are only given if half of the affordable units accept vouchers. So we're actually building quite a pipeline of voucher accepting units currently. It's not enough, not saying it's enough, but it's a good start.
I'll add in that Houston, I'll go back to this quote, in this article, the author identified two other key things in Houston. One was a regulatory environment that allowed for a lot of housing to be built. And to your point that it involves federal subsidy, it involves landlords who are willing to participate. So housing is a critical piece. We know that the number one indicator of rates of homelessness in a community is housing cost. And the continuum of care, the concept with the continuum of care is really to do that high level problem solving. So it is to acknowledge that there are just a number of threads you can pull on, a number of associated issues and contributing issues and problems to be solved. And the continuum of care intention is to create the framework, create the platform for those problems to be solved by the appropriate people who have that ability to take action. So with that, sorry, one sec. With that, I am going to invite Lance Crawford up to join me. Lance has been the chair of the governance work group and has really led the effort on how we restructure our continuum of care and on developing the charter that he's going to walk us through. Lance is also the vice chair of the Homeless Initiative Advisory Committee. And then in his spare time, his side hustle is a full-time job at Goodwill as the director of workforce development.
Let me just really quickly say, we do have this super tight agenda for today to try to get through all of these presentations and the 98 slides that Emily mentioned. And I know there's so many people here that are eager to speak, and I saw some hands raised in the audience. And we did not intend for this meeting, unfortunately, to include public comment, and we don't have time for it today, but maybe during the break we can spend a moment and talk with some folks who are interested in speaking with us.
Good morning, everyone. As Emily said, I'm Lance Crawford, and I serve as the chair of the governance work group. I'm here to give you an update on what we've been up to over the past 10 months or so. So the governance work group was established by HIAC back in February. The members of that group come from membership of the HIAC, Homeless Coalition. We have a community representative, Buncombe County, city staff liaison, and city county liaison. When we started back in February, we began to study other structures recommended by the NAEH, including Spokane, San Diego, and Houston. So we began to just dive into their charters, look at their structure, and begin just putting together the pieces that would eventually become the COC structure and charter for our area. We also worked with technical assistance from HUD on the best practices and effective COCs. And I just want to recognize this group. We have representatives from different organizations, and it's a group of very passionate people who want to help create a response to homelessness. So a lot of hours, a lot of meetings, a lot of research, a lot of time on their own went into the work that we've done over the past few months. So really proud to be a part of this group. So the governance work group developed the new charter that was endorsed by HIAC in October. So to be implemented, though, the charter must first be formally adopted by the full membership of the continuum of care. And in order to do that, we must first establish that full membership of the continuum of care, which is in works right now. So the purpose of the governance charter, as you see here, it set out the composition, roles, responsibilities, and structure for our local COC. The COC, of course, is a collaborative planning body for developing and overseeing a comprehensive and well-coordinated system of effective services designed to quickly resolve occurrences of homelessness in Asheville and in Buncombe County. So this charter describes the governance structure, kind of how it all works together. It's anchored in our community values as identified by NAEH and adopted by HIAC. And I just want to point out a couple of those. One is to be bold. We've really adopted that value. The timeline that we're on is pretty aggressive. I think that we have done, this work group and everyone who's been involved has done a really great job of pushing the recommendations forward and creating this charter and this structure so that we can move forward with what we're trying to do. The second one is to create, that I want to mention, is to create accountable and transparent governance structures, which is what the governance work group has set out to do with creating this charter. So, the COC membership is an inclusive and diverse body of stakeholders working together to strategically and effectively respond to homelessness. So this is open to any individual or organization with an interest in understanding homelessness and taking action by contributing to the COC's goals. Members' rights and responsibilities include voting to initially adopt the charter and vote on future charter changes, to vote on board membership, and they're eligible to serve on the board, committees, and work groups. Member organizations eligible to apply, if they become a member, they're eligible to apply for COC and ESG funds and any other funding that's managed by the COC. They'll have their HMIS fees covered and can request a letter of support from the board. So that brings me to the COC board. So the COC board is the decision-making body for the COC. Their responsibilities include setting strategy and priorities for the COC, adopting policies, including standards of care, allocating resources managed by the COC, establishing committees and appoint COC members to serve, designate the lead agency and HMIS lead, and manage an MOU with each of them. So this group is a representative subset of the COC board, the COC membership, and intended to convene leadership of cross-sector systems of care. So their focus is on system development and governance. And this board is going to be, our hope is to be composed of people with fiscal and program authority over their respective organizations. So I would encourage those who are passionate about this work to use your influence to get people who have fiscal and program authority on the board. We're going to go into what the seats look like on this board, but I want to encourage you, if you're passionate about this, speak with your peers, speak with your community, get people involved. So, the COC board has a few different sections as far as how the seats fill in. Representative seats are elected by COC membership. So I mentioned earlier, the full COC membership will vote in people for the board seats. So subject matter experts with lived experience of homelessness will have 2 seats. We'll have someone from healthcare system, behavioral healthcare system, local non-governmental funder, unsheltered service provider, interim housing service provider, permanent housing provider, someone from the business community, faith community, 2 community members, and 1 from a supportive provider network. So the next portion of the seats is appointed seats. So these are staff designated by the organization in which they serve. Those include the Housing Authority of the City of Asheville, Buncombe County, City of Asheville, and the Veterans Administration. This also includes non-voting liaisons from Buncombe County and from the City of Asheville. So Buncombe County Commissioner and a City of Asheville Council member. All right, so within the COC ecosystem are committees. So the board creates committees and appoints COC members to serve as voting members. All committees must include members with lived experience, and the lead agency staffs all committees. Committees are going to be very instrumental in engaging community expertise to advance system development and improve outcomes. So this is where a lot of the work comes into play for the goals that we have in place. They're key roles based on the NAEH recommendations. Now, not everyone is going to have a seat at the board. There's a limited number of seats, but really where the work of what we're trying to do happens is going to be on committees and work groups. So we really need subject matter experts to serve on these committees so that we can move forward. So some of the standing committees that are established in the charter are system performance, system planning and implementation, funding, community relations, and nominating and membership. All right, so the lead agency. The lead agency provides strategic and administrative support, assists the COC in fulfilling the regulatory responsibilities, serves as a designated collaborative applicant to submit the COC's annual application for federal funding for homeless and housing projects. So the lead agency's responsibilities and an assessment process will be documented in an MOU with the COC. Some of those responsibilities include facilitating annual federal funding processes, proposing charter amendments to ensure HUD compliance, and supporting the COC membership board and committees through providing orientation, drafting and publishing meeting materials, and managing communications. So the charter continues designation of the City of Asheville, the Homeless Strategy Division, as lead agency to be reviewed within 3 years of charter adoption. So lead agency has a lot of work to do, right? There's a lot of responsibilities that they oversee. And I think a lot of times within a COC, the lead agency can get the most criticism. But one thing I want to point out is it's not the lead agency's job to end homelessness. That is the COC's job. That is a collective effort for us to create a response to homelessness. And the lead agency is a part of that. So one thing I do want to mention as well, as we've done our research with other COCs, sometimes the COC is a nonprofit. So it wouldn't be a governmental agency. It would just be a separate nonprofit. The NAEH did not recommend that we make that change from a governmental agency to a nonprofit. And our technical assistance provider from HUD actually cautioned us to not do that at this time of transition into the new COC. So obviously, a brand-new nonprofit, along with this process of creating a COC, would be pretty difficult to start. But if the COC wants to pursue that in the future, the charter does allow for that to be an option. So we do often see government agencies as the lead agency. You know, a lot of times the staffing and resources with the government agency is built in, and so a lot of times we do see that. So it's very common. And I do just want to say that the current lead agency, the City of Asheville, has an incredible staff, a very passionate and competent group of people who have really provided some great leadership in this time of transition. All right, so the Homeless Management Information System, the HMIS, the HMIS lead really mirrors the structure of a lead agency relationship. So the HMIS lead operates the HMIS on the COC's behalf. The HMIS lead responsibilities and an assessment process will be conducted in an MOU with the COC, much like the lead agency. And their responsibilities include maintaining the HMIS in compliance with HUD standards, coordinating all related activities, including training, maintenance, and technical assistance, supporting privacy, security, and data quality plans for the HMIS, and reporting on HMIS participation to the COC. So again, the charter continues designation of the City of Asheville Homeless Strategy Division as HMIS lead to be reviewed within 3 years of charter adoption. So it's very common for a lead agency and the HMIS lead to be the same organization. But again, that can be reviewed in 3 years, and that will be up to the COC to make any changes necessary there. All right. So a process and timeline. So the governance work group that was established by HIAC back in February has evolved into the nominating and membership committee as described in the charter. That was authorized by the HIAC back in October. And phase one of what this committee plans to do and is working on is to build the COC membership. That is priority number one for us. So it's underway now, and it's open to any individual organization in Buncombe County with an interest in understanding homelessness and taking action to address it. So we actually do have paper forms for membership, as well as electronic versions as well. And that's available today outside in the lobby. So I'd encourage you, if you are passionate about this work, if you want to be involved as an organization or as an individual, please become a member today. So our goal is widespread participation. Again, the forms are posted on the city's Homeless Strategy Division website and distributed widely in paper and electronic formats. So once the forms are submitted, those will go to the city's Homeless Strategy Division and reviewed by the Nominating and Membership Committee. New members, when they do fill out a form to become a member, they're given a charter and they are invited to share feedback on the charter. As Emily said earlier, this is where we're at right now. We're certainly open to feedback. We're certainly open to any recommendations that we can take back to the committee and really look into. So prior to adoption, people are going to have the opportunity to make those, to give that feedback prior to the first full membership meeting, which, speaking of, will happen in early 2024. We haven't set a date for that just yet, but that meeting will be focused on charter adoption. So feedback that is received during the membership drive is going to be reviewed and incorporated by the Nominating and Membership Committee into a final version that will be presented to HIAC. The HIAC endorsed final charter will be presented to the full membership to vote on adoption at its first meeting. So once the charter is adopted, the process to seat the first board will begin as described in the adopted charter, and that includes a call for open applications and nominations for those board seats. So phase two, as I mentioned, is to establish that COC board. The second full membership meeting, so the first one will be about adopting the charter. The second one will be to elect the new board. So the new board will participate in COC board trainings. They'll develop strategy and priorities, and will lead prioritization of NAEH recommendations for the next phase of implementation. They'll also appoint COC members to committees based on specific skills and expertise, and establish additional committees as they see fit. So, for the city and county, here's what we really truly believe needs to happen next. So route all homelessness efforts and resources through the COC rather than operating independently. Appoint senior leaders with fiscal and program authority to designated board seats. We are really looking for folks who have influence and resources to be able to push the goals of the COC forward. I also encourage you to make staff available to participate in committees and work groups based on their specific skills and expertise. Engage senior leaders at partner systems of care in board participation. Also dissolve HIAC once the new board is established, and then continue to invest in staff capacity to advance the progress. And then to the community as a whole. As I mentioned earlier, become a member of the COC, whether that be on an individual basis, organizational basis. We really believe that this moving forward is going to be a collective effort, and it really does truly take all of us. And I'm really excited about the COC moving forward. There's been a lot of hours and research, hard work, meetings that have gone into this with a lot of passionate people who are ready to go. And I want to encourage you, if you are ready to join us, please do become a member of the COC today.
Yes. I want to first just thank you and the COC subcommittee so much for all of your hard work, and for, we're sitting here today 11 months later and we have a draft charter for the new COC. That's fantastic. For the council and the commission, you might be wondering, what are we supposed to do? And so all we're supposed to do is to dissolve the HIAC, and then the COC can create itself. We will continue to provide staff support to the COC, as well as each body provide a non-voting liaison to the COC. So that, in terms of our action items on this transition to this governance structure, that's what my understanding is, and anybody correct me if I'm wrong, but of what our role would be in that.
There is one other thing that I think that the city and the county could do just from our own learning experience. The questions that I hear about trust and coming together as a community to solve these issues is making sure that the meetings are streamed and archived for educational purposes, so that more folks can join the conversation and add to understanding. And that's not something we can require, but I do think it's something that our organizations could suggest from our, once again, our own learning experience.
Any other questions?
Can I make a comment?
Sure.
What you said is exactly right, and if I can just add, I think part of the intent here is to ensure that the city and county are at the table. City and county leadership have critical roles in responding to homelessness in our community, and it's building out the table beyond the city and county, recognizing that we need lateral partners, we need shared power across our community in order to take shared action. So city and county will continue to have an important role, but it really right sizes the role of what those entities are able to bring to the table.
Thank you.
All right, strategy 2. So again, strategies 1 and 3 are our most dense content today. So I'm going to move quickly through strategy 2. This is implementing evidence-based and inclusive policy, which is really about building up the continuum of care, or the homelessness response system. There were a number of sort of disparate recommendations in this strategy from the Alliance, so a number of different activities here. Key takeaways, are that capacity building has begun through many concurrent efforts across the system and the community. I would say that we, as a widespread community, that we've historically underinvested in capacity building. And so it will take us some time to catch up. And the work of capacity building is ongoing in perpetuity. And it takes capacity to build capacity. So it means that we need buy-in, we need investments of time for staff, certainly takes capacity on our end to help facilitate this. But it really takes a lot of capacity from providers and folks in the community who are busy doing the work day to day. It's difficult for them to step away and participate in trainings or planning activities. And so I want to really acknowledge that and appreciate that investment. And then also getting the right person to the right seat at the table is important for working with greatest impact. You just heard from Lance about how that continuum of care restructure will help us move that forward. You see that we had in strategy 2, we had about half the priorities and action steps that we had in strategy 1. So again, just emphasizing the importance of getting that COC restructure right. We had a number of recommendations from the Alliance on training as we look at capacity building in this section, specifically to establish a housing-focused system-wide orientation. The Alliance recommendations were really specific to the Housing First model, and I want to say this really clearly. I think this has been a tough topic in our community for a while. Housing First is an evidence-based practice that does work. There is an enormous amount of research substantiating that Housing First does work, evidence-based practice. But I also want to name that other approaches used in our community also work, and that there are many pathways to exit homelessness. We have a diverse homeless population. People need different things, just like all of us. If we continue to be divisive about what works and what doesn't, then I think that is a distraction from our collective goal. And so I want to, again, say really clearly that all pathways out of homelessness are valuable, are needed. People need different things. If we have an array of options available for client choice, we will achieve our best outcomes if those interventions are aligned in a common direction of housing and stability. Again, Alliance recommendations really anchored in the Housing First model, which we know does work, and so we did facilitate a training from the Alliance on Housing First and are convening a regular Housing First community of practice to really build up some peer sharing, peer learning opportunity across our community. We have training under development right now on multiple pathways to housing out of homelessness. And then we have also been providing a homelessness learning series that you may have seen about in the media. I will invite Debbie Alford, who is our training and development specialist in the Homeless Strategy Division and has been leading the homelessness learning series. I'll invite her up to share more about that.
So during their time in Asheville, the National Alliance to End Homelessness found that people in our community wanted to know more about homelessness. So people interviewed spoke about their desire to know more about people experiencing homelessness and then the ways to help those people in a housing crisis. So the Homeless Strategy Division created a 3-part series in order to help give people more information about homelessness in our community. The goal is to provide basic information about homelessness for community members. Providing this information is important because ending homelessness takes all of us. It takes business owners and community members and neighborhood associations, faith communities, schools, social workers, nonprofits, and for-profits. So through this 3-part series, participants learn about homelessness in the Asheville-Buncombe community. And in session 1, we explore who is in a housing crisis and discuss some of our data. And then in session 2, I lead participants in a deeper dive into what it means to have a system like the continuum of care designed to end homelessness at the individual level. And lastly, in session 3, I provide an opportunity for participants to consider their response to what they've learned. We spend time discussing shelter and housing organizations, making an impact in our community, and provide opportunities to connect with those organizations. So the series repeats monthly. Each month offers a different time and day of the week to allow for increased participation. As the new COC structure begins to take shape, we anticipate that this learning series will be integrated into the Community Relations Committee, and incorporating the series into that committee's regular work aligns with the COC's community values because it provides greater collaboration and involvement from providers, people with lived experience, and others in our community. So far, the series has had really outstanding participation. We've had 174 participants in the last 2 months. The December series starts on Thursday at 10 a.m. at Stevens Lee Community Center, and the link is on the slide. We encourage everyone who's interested to register for that December or January series, and then the February series those dates will be coming soon. So the National Alliance to End Homelessness recommended that our community implement cross-system training for service providers in best practices. The providers in our community have been working really diligently to help people resolve their housing crisis. And all of this work is stressful, and there's been high staff turnover, especially during the pandemic. So the goal of this recommendation is to promote, and deliver training to organizations across the community in order to increase knowledge, skills, and capacity. This involves solidifying an annual training plan that will provide ongoing support to staff working on the ground with people experiencing a housing crisis. We've already begun the work, and this slide shows some of the training that's been offered during the past year. As we've scheduled these sessions, we are collaborating with local facilitators to share their expertise in order to build capacity across our community. So going into the new calendar year, we are planning to offer about 2 training opportunities per month, and these are just a few of the topics being considered. So many of these will be ongoing on a yearly basis to support new staff onboarding. And by building out this robust training calendar for service providers, it will help them provide more knowledge to engage with their clients, and our system will be more effective at helping people resolve their housing crisis. Because of the time investment, we know that it's difficult to prioritize training. Staff helping people in a housing crisis have very full work schedules, and despite the time involvement, we've had good participation in training thus far. Organizations have prioritized training, and staff are committed to building their knowledge, and I'm really thankful for their participation.
All right, we have talked this morning a bit about the importance of integrating folks with lived experience into our collective response. We certainly got a number of recommendations from the Alliance around this, specifically into system and program level decision-making, service delivery, and system policy, and to provide compensation. Actions so far, we have had meaningful participation on HIAC and in all work groups, and the new Continuum of Care Charter, as you heard from Lance, does designate a board seat, 2 board seats, and requires inclusion in every committee and in every work group. So the goal is to have a seat at every table dedicated to someone who has lived experience of homelessness. We don't yet have a compensation source or a structure identified, so that will be the purview of the new Continuum of Care Board, but our staff is working on developing a framework for consideration. There are a number of models for this across the country, so we have a lot to draw on in putting some plans together to share with that new board for consideration and adoption. I'm going to attempt to show you a very quick video about Just about the importance of making sure that we have folks with lived experience at the table. There are a number of reasons why that really matters. This is just one of those reasons.
I think my favorite thing about participating in all of these work groups is finding that person who looks at me and says, Elvia, I never thought of it that way. You've changed my mind.
So, again, really important to have folks with lived experience at the table who can educate people who may not have that experience. If you think back to the comparison with the healthcare system and the importance of patient-centered care, we know that it's important to hear from people receiving care about whether or not that has worked and what could have been improved. Same thing is true in homelessness response. There's a real emphasis on nothing about us without us. We want to be sure that people who understand what it is to be homeless, understand what works around homelessness, are really critically involved in the collective efforts of the planning body. We also got a recommendation from the Alliance around implementing an encampment resolution policy and strategy that reduces negative impacts and enforcement and increases engagement. This was one of HIAC's prioritized recommendations, and said that they established an outreach and encampment response work group that reviewed local practices and drafted considerations that were presented to HIAC. One of the challenges with this particular work group was related again to that that seats at the table idea. The composition of this work group lacked decision-making authority. They certainly had a lot of investment in this issue, put in a lot of time and effort, and drafted those meaningful considerations, and just didn't have folks with decision-making ability at the table. The new charter, again, as you heard, is clear about how folks are appointed to committees. We know that we have a lot of work to do on this, and so staff will be following up on next steps. It's a very complex issue in our community and really relates directly to everything we've been talking about around capacity building in our service system so that we have the capacity to provide that engagement and alternatives. We also got a recommendation around access to services, having a clear and transparent written process of how to access homeless services on the COC website. If you have tried to access homeless services in our community, it is very complicated. It is a complex web to navigate. It is really currently dependent on the person in crisis to find the right resource for them, and that's a problem. That is a definite thing that we need to resolve. The HIAC Coordinated Entry Work Group has been working on access points to try to clarify that and streamline that. And county staff are developing an interactive map of services to be available online. So there are action steps being taken on this recommendation, but we certainly still have a lot of work to be done here. That's it for strategy 2. Any questions or comments?
I'm just going to reiterate that we haven't identified a structure for compensation. This is suggested. We know that it will work. We have adopted these strategies. And I did forward the invoice from the person with lived experience, or one of the 2 people with lived experience on the HIAC, reflecting the work that they've put in. Though we haven't identified an option for the future COC, we should certainly consider modeling the kind of behavior that will get us the results that we need.
All right, thank you.
Good morning, everyone. My name is Lacey Hoyle, and I am excited to be here as the Homelessness Program Manager for Buncombe County. I was here at the meeting in January with the National Alliance, and I left that meeting very inspired and hopeful about what's possible for our COC and what it could look like in the future. And my enthusiasm just continues to grow in this new position. It is an incredibly important and exciting time for the COC. To tell you just briefly about my background, I come to the county after 16 years of working in social services here in Asheville, including several years of case management and management of a permanent supportive housing program and 2 rapid rehousing programs. I am a servant at heart, and to be able to serve my community in this new way is exciting and humbling. So now let's talk about strategy 3. This strategy is all about system performance, specifically decreasing inflow and increasing outflow in our homelessness services system. So today I'm going to tell you about different components of that system, or the continuum of care, and the recommendations around those services, as well as our progress on those recommendations. Key takeaways, HIAC did prioritize the strategies that we were going to focus on in 2023. And as you all have just heard, the COC structure was high priority. System performance progress is going to be contingent on adoption of that new structure. And because of the prioritization, a number of system performance steps are in the early planning phases. The county and the city have funded increased shelter capacity through December of 2024. And there is a shelter team that is currently undertaking a planning process to seek to determine how to increase shelter capacity beyond December of next year. The COC board and HIAC will likely need to seek city and county support for the shelter expansion. And so here you see there were 10 priorities in strategy 3 with 40 action steps. That's quite a lot. And now I want to just talk about the continuum. Here's a graphic for you that just represents our continuum of services and housing interventions. Folks can enter this system when they are at risk of becoming homeless or after they are already unsheltered or in emergency shelter. And the goal, of course, is to move them through this system as efficiently as possible so that they receive whatever housing intervention might be most appropriate for them. I want to just note here that in terms of our unhoused population, our 2023 point-in-time count reflected 171 individuals. So these individuals may end up seeking emergency shelter. They may not. They may choose to continue to be unsheltered. And they may skip options for transitional housing or emergency shelter and go straight to one of the housing interventions. Likewise, the 402 sheltered individuals may move through this continuum not in a linear fashion. It's not really designed to be linear. It's designed to address whatever someone needs at the point that they need it at. And that's why it's really important for our coordinated entry process to be streamlined so that providers can work together to help those experiencing homelessness to move through this system as efficiently as possible. As you can see here, one of the first ways that people can enter the homelessness system is through seeking homelessness prevention services. These services are designed to prevent an individual or family from moving into emergency shelter or living in a public or private space that's not meant for habitation. And the services do that by providing short or medium-term rental assistance, sometimes assistance with rental arrears or move-in costs if we do have to move someone into new housing, and then housing stability case management. Sometimes mediation is needed between landlords and individuals in order to prevent homelessness. Sometimes that financial assistance is also what's needed. Typically, individuals are working with case management staff to determine exactly what's needed for each situation so that the response is centered around the individual and the family and tailored to their specific needs. And again, the intended population here is individuals or families who are at imminent risk of homelessness, so they have a notice to vacate or they may already be in the eviction process. We have several homelessness prevention providers here in our community. Homeward Bound has 2 homelessness prevention programs. There's one with their Supportive Services for Veteran Families program, which is for veterans. And then there's also a civilian team that's providing homelessness prevention services. Helpmate also has funding for homelessness prevention, as does Pisgah Legal Services and ABCCM, which is also providing that service for veterans. The recommendation was to align current homelessness prevention activities with best practices and to utilize the data to target our most vulnerable households. Prevention services are designed to help decrease inflow into our system. The steps for this priority involve developing written standards and best practices, identifying partners, identifying additional funding opportunities, tracking performance, and offering training on prevention services. We have begun to make some progress towards these steps related to improvements for prevention services. Most notable of which is that there's now a monthly meeting happening between system leaders. So that's folks who are running our emergency shelters as well as our other homelessness supportive services here. And this group is talking about lots of different strategies to decrease inflow into our system, including prevention. The identification of additional funding opportunities beyond what our COC receives has not yet formally begun, but homelessness prevention providers here in the COC are continuously looking for additional funding for this service because it's become clear in recent years that the need for this type of assistance is already great and it's continuing to grow. Another service that is designed to prevent entry into the homelessness services system is diversion. So diversion is a strategy for preventing homelessness for people who are seeking shelter by helping them identify immediate alternative housing arrangements and connecting them with services and financial assistance necessary to help them return to permanent housing. So this can include, again, financial, utility, or rental assistance. Sometimes there's short-term case management involved, could be conflict mediation. So that could look like mediation between an individual who is unhoused and a family member who may be able to help them out and have space to temporarily house them, connecting them to mainstream services and possibly assistance with housing searches as well. There are not really designated diversion providers in the community. It's more of a strategy that providers are using across the board as someone enters the system to try to get them into a safe space. As I mentioned before, diversion is also designed to decrease inflow into the system, and the steps recommended by the National Alliance are much the same as the ones we saw for prevention. In the system leaders meeting, providers are actively talking about diversion and best practices, and it's anticipated that the system performance committee or possibly a work group that may be formed by the COC will also undertake writing best practices for diversion. And there's also a diversion training that is scheduled for 2024, which will undoubtedly be helpful for streamlining the services in this community. Moving on to outreach. This is a service that's designed to do both parts of strategy 3, so decreasing inflow and increasing outflow. So homelessness outreach involves moving outside the walls of an agency to engage with people experiencing homelessness on the street who may not already be engaged with services. This is incredibly important work that is designed to establish supportive relationships, to give support to people experiencing homelessness, and to hopefully enhance the possibility that someone will access services and supports that will help them move off the streets. Outreach providers may help someone get into emergency shelter or transitional housing, or they might help with connecting individuals with housing interventions. Referring back to the most recent point in time count, outreach staff are interacting heavily with the 171 unhoused individuals, but because of the count, because of the relationships established, they often interact with individuals across the continuum of care to help with connection to services or otherwise assisting someone in navigating the system or taking steps needed to maintain shelter or permanent housing once it's been attained. Outreach providers in our community include the VA, who is, of course, interacting with our unhoused veteran population. Homeward Bound Supportive Services for Veteran Families team also has an outreach component that's interacting with veterans. There's also a civilian outreach team that is based out of Homeward Bound, and ABCCM is also conducting outreach to veterans. Importantly, the Buncombe County community paramedics and the city's community responders are also conducting outreach services in the context of the services that they're providing. And I'm excited to tell you that we're going to hear from both of those teams today in just a moment about increased coordination of services and how it's helped the individuals that we're looking to serve. The recommendation from the National Alliance was to build the capacity of street outreach to ensure a multidisciplinary approach that will meet the needs of people experiencing homelessness. As far as progress on the steps that you see here, a weekly meeting of outreach providers has convened, and this group is composed of medical providers, peer support, veteran dedicated outreach staff,
housing-focused outreach staff, and community responders. On a weekly basis, they are providing targeted outreach across the city, in addition to each provider's individual outreach activities. And they're also regularly meeting to discuss strategies for engagement and to help coordinate referrals within the group. Once the new COC is in place, it's likely that a formal work group will be formed to create written standards for outreach in our community. One thing that I have been just starting to learn about is the increase in provider coordination between medical services staff, behavioral health partners, and community paramedics and responders. Together, these providers are building relationships and coordinating with each other to connect unhoused individuals with essential services, ensuring that they receive the care that they need and which might help them to maintain housing once they are placed in permanent housing. And so now I want to introduce Claire Hubbard, who's our community paramedic program manager, and Beth Beschel, who is our business manager for the city of Asheville, as well as TJ, who's EMS staff. I'd like for them to come up here just to tell you a little more about their services and the way that the increased coordination between providers is affecting unhoused individuals. So without further ado.
Good morning, everyone. Lieutenant Fortenberry with the Asheville Fire Department. I am the supervisor for our community responder program. We were asked to do this in May for a 60-day initiative, and since then we were asked not to leave. So we've continued with our services. On a daily basis, we're providing outreach services for some of our homeless in need, as well as our local businesses. We go through the city on a daily basis proactively, looking for some of the problems and situations that we have. We've been an alternative solution for the police department and our fire trucks. We've managed to get on scene and keep our police where they could go to other calls and fire trucks at bay. A lot of our business owners have been the eyes and ears for us and let us know of some of the situations that we've had going on through the city. Since we started back in May, we actually started a couple weeks before. There's only been one day that the community responders have not been through the city working, and that was due to sickness, COVID related, but we've been there every day. I can give you some examples of what we do. Last week, we had a gentleman that was in need. He had some mental needs that he needed. He's been on the streets for over 15 years, has reached out to multiple service, but never been able to come out of it. We were able to finally get him into a healthcare facility for mental rehab so he can get off the street, and he's still in there to today. We had a mother of 3 from Catawba County that was up here. 3 children, had nowhere to go. And we had one day around Thanksgiving that wasn't Code Purple, and she had nowhere to go. We stayed with her all day, but we couldn't find her any shelter. She was getting ready to go in the cold, which it was 36 degrees, which didn't constitute a Code Purple day. We were able to find her shelter for the evening, and since then, get her back into Catawba County, where she's now with her children and has a permanent residence from then. We have all kinds of different needs with homelessness. We have a gentleman from Rutherfordton County that was in the hospital but had no way to get back home. As simple as that sounds, he had a home, but it was in Rutherfordton. And for 2 days, he was on the streets because he couldn't find a way to get back home. As simple as that sounds, it's not a big deal for us. We give the gentleman a ride back home. He got back with his family and off the streets. I could tell you multiple stories, hundreds of stories of how we do every day and how we help and how we're a little different. But I would rather you ask me questions. And if you have any questions on what we do, I could stand up here all day and tell you the great successes and stories we've done through the program, but I'd rather you ask me, so.
I'd just like to extend my extreme gratitude for you all and your work and those few stories share with us how impactful it really is. My only question is, how can we do more with what you're doing? How can we have more responders, more vehicles, more response in general? And I know you probably can't answer that today, but I am looking for that growth.
I think we're going to hear a
We are going
management
we are going to hear how you could grow. That would be great. But thank you. And
Thank you.
Claire, who hasn't been up to speak yet.
Yes, ma'am.
I hear you talk about business owners.
Oh, I'm sorry. I'm not sure exactly what to do, because we're not, okay.
I just want to say really quickly, if I could get that list of business owners for the COC membership board, I would love to have that.
Thanks.
Sure.
Yeah, sorry, shameless.
All right, hey, let's hear from Claire real quick, and I'm just
Thank you.
herding us through. We're doing great, I think. I have no idea, but this section is supposed to go till 10:50, so.
I'll make it really fast. Hey, good afternoon, everyone. As Lacey said, I'm Claire Hubbard. I work for Buncombe County EMS as the Community Paramedic Program Manager. Over the past years, I've had the privilege of working alongside other departments, agencies, churches, shelters, grassroots organizations, and individuals with lived experience to develop new ways of addressing poverty, addiction, and the lack of high access medical and mental health resources for our community. It's only through this collaboration that our program can learn what works, what doesn't, and what is complicated. The complicated requires growth, to say the least. In your handout materials, hopefully you'll find a brief description of the ways we've grown our community paramedic program, along with some sample data and some current priorities. To summarize those, they include expanding MAT access as an evidence-based method of reducing opioid deaths, mobile wound care services in partnership with local providers, supporting the said winter shelter efforts through coordination between our mobile community outreach team and the existing medical and mental health care services, enhancing mobile behavioral health through low barrier access to licensed social workers and mental health clinicians, in addition to the co-response through Buncombe County Sheriff's Office. Moving forward, we'll continue to respond to the acute, long-term, and emergent community needs with evidence-based strategies. And I'd like to close with two stories that best illustrate the incredible power of coordination behind our successes, or one story if Emily gives me the eye. But I'll just look at you after the first one. A 43-year-old male who'd been unhoused and experiencing alcohol use disorder for several years became estranged from his ex-wife and their young children. He found his way to a sober living house in Asheville and was quickly referred to our outreach team for wound care by the manager of the house. The team assessed him and recommended higher level of care at the ED because, with his diabetes and alcoholism having been uncontrolled for so long, he had a full thickness toe wound that was extremely deep and showed signs of major infection. So with this, we worry about bone infection and a need for IV antibiotics. So he was reluctant to go, but after several days of discussing how it might enable him to walk well and get a job again, we convinced him of the necessity and transported him to the ER, where he received medication to get his blood sugar under control and IV antibiotics for over a week. When he was released from the hospital, he started coming to see our wound care nurse for follow-up care, and they worked on his foot wound together, making great progress. Eventually, she referred him to our MAHEC provider colleagues in the field, where he was able to get to Sharps debridement and establish primary care, where he still is now. He was also referred to our colleague Luke, who's a pretrial release coordinator, for advice on dealing with some old legal issues so that his life can continue moving forward without additional roadblocks. This person recently got a job at a factory and still comes to see our outreach nurse weekly for foot care checks and to address any issues that pop up. He's also reestablished contact with his young children and was able to visit them to celebrate his preschooler's birthday 2 weeks ago. The second one's shorter. And is also through the lens of one of our newest community paramedics via our recent MAT expansion. She writes, "My first day on shift, I went to a 30-year-old female's induction onto Suboxone. I then went to several MAT dosings for her over the next couple weeks and witnessed for myself what low-barrier MAT programs can do. This patient was originally very guarded, not very trusting, very shut down. She repeatedly expressed depression, anxiety, and defaulted to substance misuse, although she expressed constant concern about fentanyl contamination and dying. She stated she hadn't been physically or mentally capable to work and was fired from her last job. She was staying with her partner, but was concerned that her instability would result in her becoming houseless. She talked about the constant grief of her mother dying and having a huge amount of regret about not mending their relationship prior to the death. It was her partner who reached out to our team via word of mouth from a cousin who had been on the program, stating that there was nowhere left to turn and that everyone in the family was very scared for the patient's life. When we got there, the patient spoke with her head down that day, occasionally in tears and very anxious. She expressed needing weekly support in MAT. She was dosed for a few days, then enrolled in the Buncombe Bridge to Care at Mayheck, where she's been successful in MAT. She was also connected with our colleague Luke to help resolve her pending legal issues. Recently, she called our community paramedic phone to let us know that she was thriving in her group meetings and connecting well with her peer supports. She was laughing and positive and let us know she currently has a job interview lined up. And in fact, she may have gotten the job by now. So, thank you for the opportunity
Claire,
to
you
speak.
did so great, but we talked about the abbreviations. Medical assisted treatment.
Yep, medication-assisted treatment,
Medication-assisted treatment, so.
which is
MAT.
medical, so.
So your team helps assist people with MAT and also a program in the jail, but you're a mobile.
Yes, mobile
provider.
Suboxone via medication-assisted treatment, which used to be an umbrella term for all things, methadone, Suboxone, Sublocade, but now it is most commonly referred to as Suboxone induction. So yeah, we do work alongside the jail and the other OTP providers. I don't know what that one means, but it's providers who deal with MAT. So we are working with many partners, including the jail, to make MAT more widely accessible. I'm very tall, and this is very low. I should have done this.
There you go, yeah. So Claire doesn't love to get all the kudos herself, and she doesn't get all the kudos herself because she leads a great team and works with a lot of partners and providers, but truly has built an incredible network now in Asheville and Buncombe County to provide medical services to people out in community, in shelters, and coordinating that care. It's been phenomenal to see it. I've had the chance to watch it. A lot of us have done a ride-along, but now seeing the providing of care in places like A-Hope and in Haywood Street Congregation, just an amazing new normal for Asheville and Buncombe County. And you guys have you just pulled it together with great leadership, and that's to be applauded and celebrated. So thank you so much.
Thank you. I'll extend that applause to our leadership from the county here as well. Yeah.
So we are on schedule, maybe even a couple minutes ahead of schedule. So if there's any,
No, we have
are we not?
another.
Oh, we have one more before. Okay, I'm wrong.
Good news, bad news. You're going to hear so much more about shelter, which is important.
Okay.
Awesome. Thank you for coming up to share with us some stories about how your services are really helping individuals in our community. Before I talk to you all about shelter, I want to talk about coordinated entry just briefly. So coordinated entry is a streamlined system that provides quick access to individuals and families that are seeking assistance through a coordinated referral and housing placement process. The system and processes can differ from one community to another, but the goal is to have an efficient system through this coordination. Unhoused individuals will likely go through the coordinated entry process in order to receive a permanent housing intervention. This process exists already in our continuum of care, and right now we are retooling it so that it's more collaborative, unified across providers, and that will help make it more efficient and decrease the amount of time that someone might be waiting for a housing intervention. So the National Alliance recommendation was to begin to make improvements to the coordinated entry system, and this was prioritized by HIAC upon release of the Within Reach study, and a coordinated entry work group was formed to address the steps in the recommendation. This group has reviewed best practices, and they have facilitated bringing our COC into alignment with those processes They've recommended revisions to the process to better prioritize individuals that are fleeing intimate partner violence. And they're working right now on the development of a community by name list, which is a comprehensive list of every person in a community that's experiencing homelessness that is updated in real time. Coordinated entry work will continue with the implementation of the new COC structure. We need to continue defining access points, which is points where people can go to kind of enter the coordinated entry system and begin interacting with providers. We also will be providing training to mainstream COC partners about coordinated entry so that providers across a wide sector of fields understand the purpose of coordinated entry and how to help someone through the coordinated entry process. All right, so another very important component of our continuum of care is emergency shelter. Emergency shelters are designed to provide temporary shelter and services to individuals that are experiencing homelessness. Many of the shelters in our community are providing important essential services such as case management, employment assistance or job training, and assistance with housing placement. Emergency shelters are a critically important part of the services that our continuum offers for obvious reasons. They are helping to get folks off the street and helping them to access other services as well as housing interventions. We have several shelter providers in our community, including WNC Rescue Mission, ABCCM, who operates Transformation Village, the VRQ and Costello House, the Salvation Army, and Safe Shelter. Although we do have several providers, the National Alliance was able to identify that we don't currently have enough shelter beds to meet the need in our community, and that's the basis of this recommendation. So the recommendation is to increase crisis response capacity to meet 30% of the immediate problem-solving and shelter needs of unsheltered homelessness. I want to just point out a couple of things within this recommendation that are going to be important to keep in mind when it comes to how our community will address the recommendation. I first would like to note that the National Alliance would like for us to expand effective shelter bed capacity by 30%. And the National Alliance believes that effective shelters embrace the housing first approach, implement safe and appropriate diversion, and offer immediate and low barrier access to anyone that's facing a housing crisis, as well as measuring performance of emergency shelters. They also say here that having more non-congregate beds, which is beds that are not in a large group setting, it might be one individual or perhaps two individuals per room, that would significantly improve the number of people who might utilize shelter. And so, as you all know, this recommendation is also one that HIAC prioritized. They formed a shelter work group that did really great work earlier this year to research best practices for emergency shelter and to request partnership from different providers who identified as being able to increase their capacity. The result of this work was that the county and the city funded the expansion of shelter capacity by 43 additional beds across 3 providers, and those providers are the Salvation Army, Haywood Street Respite, and Safe Shelter. And that this funding also sustained 45 beds that our community was at risk of losing. And this funding will provide expanded capacity through December of 2024. So here you can see how the funding compares to the recommended number of beds to add. And we have a balance of need of 52 beds that are still needed in order to meet the recommendation. So the National Alliance recommended that we add 60 single beds, so those are beds for single individuals, 25 enhanced beds where individuals can access supportive services on site if they desire, and then 10 beds for families. We have increased the number of beds in all 3 categories, but we need more single beds and more enhanced beds in our community. And since the National Alliance recommended a low barrier shelter to meet the remaining gap in beds, we are now looking at the opportunity to collaborate to do just that. So, having said that, I want to tell you more about the progress that we're making toward the development of a new low barrier shelter in our community. And low barrier at its core means that there are minimal or limited requirements for entry into the shelter. Individuals seeking shelter do not have to commit to programs or additional services in order to get in, and accessing the shelter itself is easy to navigate. A team comprised of county and city staff and management, members of the HIAC, and key members of the original HIAC shelter work group have formed and is meeting regularly to move forward with planning to address the shelter capacity expansion. So our planning process is as follows. We are evaluating existing resources to further identify not only areas where there might be gaps in services, but to understand the flow of services as well as the flow of the population as they access those services. This is to help us with designing a service model that will work for our community, as well as selecting a location when we get to that step. We have been reviewing service models of interest. Some were recommended to the shelter work group, and some were models that members of the shelter team have identified as being of interest for our community. This review has informed the group on best practices for low barrier shelters, and it's provided some valuable information from peer communities on service provision, safety, and other important considerations. Right now, we are in the midst of learning about space planning needs and talking with community partners to gauge interest in providing services at this location and to determine what they might need in terms of physical space within shelters, in the hopes that we're also researching best practices on planning space within shelters in the hopes that we can create something that folks will really want to utilize and feel safe doing so and feel comfortable. After we have completed these steps in the process, we'll be reviewing those needs as we evaluate potential site options in the future. As the team has been reviewing service models, we've also looked at the National Alliance and HUD best practices for shelters. As you can see here, the National Alliance recommends immediate and low barrier access and a housing first approach. And so what are some specific ways that a shelter could be considered low barrier? Staying open for intake 24/7, elimination of sobriety or income requirements in order to get in, elimination of requirements to participate in programs in order to maintain a bed, allowing pets, which is a big one in our community, and having adequate space for families, particularly non-traditional families, like perhaps a single father with a daughter, so that they can stay in the same space together in shelter. Essentially, low barrier shelters are removing obstacles that keep many unhoused people from accessing shelter beds. Oftentimes, low barrier shelters will utilize peer-centered approaches to help with maintaining safety and creating a sense of community in the shelter. And low barrier shelters typically have services co-located on site to offer easy access to those services for individuals who want to access them. And you can see that the HUD best practices align with this low barrier approach. They recommend avoiding charging fees, allowing people in who are intoxicated, and not asking for references or other unnecessary requirements for entry. So the shelter team has been able to identify a few key models of interest, including Flagstaff Shelter Services in Arizona. I want to just say at the end of this journey, though, that we are hoping to create a model that works for our community rather than duplicate services that might be provided elsewhere. So with that being said, I do want to tell you about Flagstaff Services because many of their practices and services are of interest to the shelter team in our review of models. Flagstaff was identified by the National Alliance as using best practices in their shelter operation, and their leadership was interviewed by the HIAC Shelter Work Group as part of research around low barrier shelters. So this shelter is low barrier in that there is no requirement to have ID for entry. They are allowing pets. They're able to serve families. There's no sobriety requirement for entry, no drug testing, and they are even able to safely allow individuals who are intoxicated to come into the shelter and stay in a separate area, access a meal, and stay warm until lights out, at which point they can enter the shelter and utilize a bed. They're open 24/7, and they use a trauma-informed approach to safety services. They don't have security guards at the shelter, but they do have dedicated staff whose job it is to monitor safety in the milieu of the shelter and communicate issues to other staff, And all of the staff there are trained on trauma-informed care and de-escalation strategies. And so here are the services that they are providing. They have emergency shelter beds, some of which are congregate, which is many beds together in one large space, and some of which are non-congregate, which is, again, small rooms that house ideally one individual, but perhaps two individuals or a family in one room. They have day shelter services on site, and these are essential services provided to unhoused individuals, such as access to showers, mail, and access to various supportive services. The day shelter in Flagstaff is open to individuals utilizing the shelter as well as to members of the general unhoused community who may not be shelter residents. Flagstaff offers medical care. In their case, they have a mobile medical unit that is run by a hospital in the area that comes to their shelter a couple of times a week. In other shelter models that we reviewed, some of the medical space is like a dedicated medical clinic. Sometimes there's staff on site daily in that clinic. Sometimes they just have clinic space, but they're working with a variety of providers to have medical care available in the shelter every day. And the same is true for behavioral health services. There's lots of different ways to do it. You can offer it on site daily in a dedicated space, or it could be that services are provided in collaboration with one or more provider who may come in and provide those services on certain days of the week. Other services that are offered at Flagstaff and that we are interested in offering for our shelter are case management, help with transportation in some form or fashion. It could be bus passes, it could be a dedicated vehicle, housing placement support, meals, and also employment support. So these are all services that obviously are greatly beneficial to the community of unhoused in our area. And there are also many partners in our community who might be interested in service provision at the shelter. We are having those conversations now. So the Flagstaff model is one that we really looked at and liked, but what we learned from our review of service models is that each one is practicing the low barrier model a little bit differently. And we have an opportunity, as I said, to kind of design what will really work for us. In terms of next steps, we're going to be continuing our planning process. We'll be continuing to work on space planning and determining the feasibility of offering all of the services at a single site. We're going to be continuing to talk with potential partners about capacity, space planning, and services that they may be able to offer. We anticipate that we will bring recommendations to the COC board in spring of 2024. And once the COC team has received and endorsed the team's recommendations, we expect that they will need to convey needs to continue to support this project from both the county and the city. And I want to just finish up this section by saying that a low barrier shelter option is critical for our COC to undertake, not only to meet the recommendations of the Within Reach study, but more importantly, to get as many people off of the streets and connected to housing and other services as we can. It's our most important next step in addressing the need for increased shelter capacity that is low barrier and accessible for everyone. The county is committed to continuing to oversee the planning process for this project, and we are continuing to prioritize collaboration with the city and with HIAC to make this much needed solution happen. And with that, I am open to questions if you have any.
Everybody knows the break comes after this, but are there
Right.
any other questions or?
Maybe just high level, could you share your thoughts around what the likely timeframe will be around analysis of a potential site in the community?
I mean, I think the goal is to have something in place or imminently in place by the time the funding for the temporary shelter expansion is done, which is in December of next year. So we're moving pretty aggressively at this point to try to make this happen.
And that's an important thing to highlight because the cost of just bringing online the additional 43 beds through December 2024 was $1.75 million. So that is a huge cost to continue to try to fund year over year on this temporary basis. So this is looking for a more permanent solution.
And just to clarify your response, is the goal would be to have a facility identified and operational by December of 2024, or is it to have it identified and then might realistically become operational sometime after that?
I mean, I think the goal would be to have it operational. We may not have every service available on site at that point. We may bring some on kind of as we get going, but we really don't want to lose the 43 beds. We want to continue to have space for individuals. So I think that we would like to at least be able to offer beds to folks and maybe some basic services by December of 2024.
Okay, terrific, thanks.
Any other questions?
Okay, great. So thank you so much. So we'll take a, can we take a 15-minute break? Yeah, it's 11, let's do 11:15.
Okay, welcome back. We have two more strategies, lighter content than the first section. Strategy 4 is all about data and reporting. We want to be increasingly performance-driven, which means we need to understand what works, and not just anecdotally, but through clear data. So the strategy is all about improving our data. Some key takeaways here are that data are improving continually. We have a dedicated data and compliance specialist in our division. I want to call him out right now. Charles Young on our team has done an incredible job. That's right, yep. Doing a really incredible job of improving our data collection, data quality, and reporting in our COC so that we understand who's homeless here and how they're flowing through the system. He's been highly engaged with providers who are using the HMIS on training, technical assistance, and capacity building. And data quality improvements, this is important to understand, data quality improvements will have a snowball effect, so data will become increasingly meaningful over time. As we do our annual federal reporting, that's always looking at a reporting period for the prior year. And so until our data really get caught up with a high quality and high degree of accuracy, we won't be able to really clearly understand what that system performance looks like. You heard from Lance that in the new charter, there is an established system performance committee, and that committee will have a key role in shaping our data governance and building out the utility of our HMIS. This section only had 2 priorities, just a few action steps, and those 2 priorities are here. So improve utilization and reporting, and build system and program capacity for greater understanding and commitment to data-driven decision-making. I've got a checkbox here because this, again, is the action step that we have really heavily invested in through the work that Charles has been doing, and this will be ongoing long-term in our COC. So provide ongoing HMIS training in data collection and quality so that staff understand how and why to use HMIS correctly. We want to be sure that folks understand how data become meaningful and how they can inform our strategy and the actions that we take together. Again, heavy investment in training and technical assistance. Been doing a lot of system cleanup work to improve utility, instituted annual provider audits, and just overall having better system administration to better reflect our progress. A really key initiative that Charles has led in our community is a data sharing agreement that took effect on October 1st of this year. Historically, in our community, providers are not able to see data from other providers in that system that they're all using. So what that means is that if I'm seeking services with your agency and another agency, you're missing an opportunity to collaborate because you don't both know that you're working with me. This is a giant project, really heavy lift to get this implemented in our community, and a really exciting step forward for us in having better data. Will improve agency coordination and should also decrease the need for people who are accessing services to be answering the same questions repeatedly. And then overall, as our data becomes stronger, we'll be able to use HUD analysis and modeling tools to continue to inform our strategy. The remaining recommendations in this section will be driven by the new continuum of care. So funders should mandate HMIS participation. Accurate data quality should be incentivized. We should invest in funding for data positions within the provider community. It takes capacity to have accurate data. That's an important investment for us to make. And we should develop public-facing dashboards so that people understand the state of homelessness in our community and where opportunities are. We do have a current dashboard on the city's website that reports our point-in-time and system performance measures, but certainly plenty of opportunity to build that out further. Questions?
Hello again. So I'm going to talk with you all now about Strategy 5, which is all about permanent housing solutions. Like low barrier shelter, this strategy is pretty crucial in order for our homelessness services system to function effectively. We need more housing interventions in our community in order to move people through the system and into housing as quickly as we can. Key takeaways. So we have new permanent supportive housing units that came online in 2023. We'll talk a little bit more about those later. More new permanent supportive housing will be coming online in 2024 and 2025. Additional rapid rehousing will come online in 2024, but we still need more solutions for permanent supportive housing and to continue to expand rapid rehousing. So here are the priorities. There were 5 of them with 18 action steps. We are in process with all the sections, short, medium, and long. So, looking back at the continuum, what we're going to be talking about now is rapid rehousing, permanent supportive housing. So starting with rapid rehousing, sorry y'all, I'm old school, so I have to have my written notes. So this is a housing intervention that's designed for people who are experiencing homelessness for the first time or who may not be considered chronically homeless. Typically, the target population includes people who have some income, and it's good if people have the ability to generate more income as well. The idea behind rapid rehousing is to provide financial assistance in the form of rental, utility, and move-in assistance, housing placement assistance, and supportive services like case management. And this can happen for anywhere from a few months to up to 2 or even sometimes even longer, depending on the funding, 2 or more years. So the goals are to help people obtain housing quickly, to increase self-sufficiently, and to stay housed, and to prevent them from being on the streets and attaining that chronic status. Currently in our community, Helpmate is providing rapid rehousing services to survivors of domestic violence, and Homeward Bound is providing rapid rehousing to the civilian population as well as to veterans through their supportive services for veteran families program. The recommendation for our community was to add an additional 200 rapid rehousing units over the next 12 months to 5 years. I am pleased to say that Homeward Bound did secure some additional funding beyond last year's amount for their rapid rehousing programs. So we will be making some progress towards this goal. And Helpmate has also continued to secure funding for their program. However, we still need focused attention on identifying new funding opportunities for rapid rehousing and securing that funding so that we can continue to grow this service. Moving on to permanent supportive housing, this is another
I have a
housing.
question.
Yeah.
How much, what's the budgetary need to meet that goal?
That's an excellent question that I don't know that I have the answer to right
Maybe
off the
someone
top
will
of my
know the
head.
answer while you keep talking, and they'll come tell us at the Q&A time.
Okay.
I mean, I know
Yeah, don't mean to
Homeward
put you on the
Bound
spot, but
received $50,000 for next year.
Yep.
But I know that the list of people, they maintain a by name list of their own currently, and I know that the list of folks who would be appropriate for rapid rehousing is much longer than what that 50,000 will sustain. Because when you think about paying monthly rent for someone, even for 6 months, and what that cost is, in addition to security deposits, oftentimes landlords are asking for double deposits and things like that. That $50,000 is going to go quickly, and it won't stretch out to that many units. So permanent supportive housing is another housing intervention that is designed to provide long-term financial assistance and services to individuals who are chronically homeless and disabled. There are a few permanent supportive housing programs in our community, primarily operated by Homeward Bound, and also the Western North Carolina AIDS Project also receives federal funding to provide permanent housing to people living with HIV and AIDS. The recommendation was to develop a pipeline plan for new supportive housing units over the next 10 years. And we've made some progress here too. We have expanded permanent supportive housing in our community since the release of the study. These units were planned prior to the release of the National Alliance study. But I'm talking about Compass Point Village, Step Up in Asheville, and ABCCM's permanent supportive housing project. So a little bit about each one. Shangri-La is the owner and Step Up is the contracted manager for the Ramada Inn conversion. This project has received funding support from the city for 3 years of supportive services. Their current status is that they are securing additional financing that is related to interest rate increases, and the opening will be dependent upon that new financing. When it does open, it will have 113 units that will be studio apartments, 50 of which will be dedicated to homeless veterans. And we also have 2 projects from ABCCM, and I'd like to invite Tim McEllier up to tell us a little bit more about those projects.
Thank you. It's great to be here this morning. I wanted to talk a little bit about 2 very important projects that we are getting involved in with ABCCM. Of course, like the rest of us in this room this morning, we realize the need for additional housing inventory to be out there and give us some good solid places to be able to provide shelter and permanent supportive housing for the homeless in need. The first project I want to talk about is 38 unit apartment complex that we're going to build at Transformation Village. This is going to be focused on single women and women with children. Of course, with Transformation Village and the transitional housing program that we have there now, which we're pretty much full there, we, like I think the other agencies, experience issues in getting people into permanent housing. So this is going to be a really good opportunity for ladies and ladies with children to be able to move in there. Again, it's a 38-unit complex currently on the grounds of Transformation Village. We plan to have wraparound services at both of the projects that we have going on. Of course, for women, we'll have case management. We have a nurse on site at both facilities. And many other wraparound services that we're going to be working on, transportation, of course, and that sort of thing. So really kind of an extension of our transitional housing programs, but taking that extra step and getting people into permanent housing and then supporting them so we can prevent recidivism back into transitional housing or worst case scenario back onto the street. We are also building an 84-unit apartment complex on the grounds of the Veterans Restoration Quarters. Of course, this is going to be, we're targeting male veterans, so veteran-centric. For those of you that don't know about the Veterans Restoration Quarters, 250-bed transitional housing facility, and we're located about a mile from the Charles George VA Medical Center. So this is going to be, again, veteran-centric, a lot of wraparound services that's geared toward veterans. Of course, it's extremely helpful to have the Veterans Administration Hospital right up the street from us and the engagement that we have there. But it, too, will have wraparound services, nurse on site, case management, and that sort of thing. And also on both of these facilities, we're also looking at building a kennel there on both of those as well to assist with folks that want to come in and have pets. Both of these projects are currently in the planning and development stages right now with us. We're looking to have them open and fully functional by mid to late 2025. Thank you.
Thank you, Tim. And last but certainly not least, we have Compass Point Village, which received funding support from the county and the city, opened in September. It is the largest permanent supportive housing program in our COC currently. There are 85 units, 78 of those units have been filled, and there's about 7 left at this point. And now I'd like to invite Homeward Bound CEO Carl Falconer here to talk with us a little bit today about Compass Point Village. And after he's done, I'm going to come back in and wrap us up here.
Thank you all for having me. Hold on, try and get that up. There we go. Thank you all for having me today. My name is Carl Falconer. I'm the new CEO with Homeward Bound. So please be, gentle with your questions. I do have my plant, Jenny Moffett, in the audience here, so she can probably answer more questions about the project than I can at this point, since this is my 4th week now being CEO. But I will try and give it my best shot to give you kind of an overview. First, let me tell you a little bit about myself. I am very happy to be here. I have worked 30 years in the homeless service system, starting as a street outreach worker. When I saw all of the slides and all of the action points and everything else, I'm kind of a simple guy. So I've always kind of broken down my philosophy into 2 things that we do in the homeless service system. Number 1, we get people housed. And number 2, we keep them from dying on the streets. And everything else is just kind of how we do it. So I appreciate the planning and collaboration and all of that, but honestly, it really comes down to those 2 simple facts. I have been a part of 10 continuums of care in my experience over time, and so I'm hopeful that I can help bring some expertise and some lived experience with COCs to this dialogue. As you can see from the NAEH priorities, collaboration is the key, and I can't speak more highly about how an example of that is Compass Point Village. Compass Point Village, as it says, has 78 residents currently, with 7 units still to be filled. Our goal there, of course, is to end homelessness for individuals, and I would say that the individuals that are there now have reached their forever homes for the most part. Obviously, even from where we are at Compass Point Village, because we do not want to create a bottleneck with the permanent supportive housing, the other thing that we want to do is be able to get people to their highest level of self-sufficiency so they could actually move out of Compass Point Village at some point and allow others to come and live there. So our goal is not to serve 85, but to try to serve hundreds and hundreds as we get people to flow through. But of course, you have to have the flow for that. And of course, that's why we talk about affordable housing, and part of the plan obviously will be about permanent housing. Lastly, I just want to say that our hope at Compass Point Village shows that collaboration and planning will lead to an end to homelessness for all of our neighbors. It really does take everyone, and I can tell you from being in 10 different continuums of care, some with lots of money, some with little money, some big, some small. The number one thing that I've seen that is successful in actually ending homelessness is collaboration. No matter how much money you have or how many resources you have, it still won't be effective unless you have collaboration together. So with that, I'll open it up to any questions you might have specific to Compass Point Village. Great. Hopefully y'all have visited.
I just have one quick question.
Yeah.
It's great to see that 78 units are filled and 78 folks are housed. Were those all folks that were currently unhoused, or were some of them in other Homeward Bound programs?
We had a few that were in other homeward bound programs, some of them not doing as well there, so we did transfer some over, but the majority of them, the vast majority, actually came from the streets.
That's amazing.
Yeah, absolutely.
Thank you, and welcome to the community.
Thank you very much. Anything else? Thank you.
Thank you, Carl. To close us out with strategy 5, I just would like to say that, as we all know, permanent housing is the end goal of the continuum. So as a few people have said here today, we're going to need to be able to offer more affordable housing, more permanent supportive housing, and more rapid rehousing options in order to prevent the bottleneck that Carl mentioned, and move people through the continuum from the streets or hopefully emergency shelter that we might develop, or we will be developing, to self-sufficiency and housing of their own. So it behooves us to continue to come together to make increased shelter capacity a reality in our community, as well as to continue to focus intently on developing more affordable permanent housing in our community. Thank you for your time, and I'm here for questions if you have any.
More than a question, I have a curiosity.
Mm-hmm.
And when I look at section 5 and priority 3H, which is promote housing services for individuals who are chronically homeless and unsheltered, with the limitations of my understanding, we don't have anyone at this table who is currently or recently experienced homelessness. I haven't. And so when I serve as the liaison to HIAC, I learn a lot from our neighbors experiencing homelessness or recently experiencing homelessness. And so I'm going to lift up HIAC member Jamie Benshoff. Quote, "Hi, I hear affordable housing, and my experience is that is a fuzzy definition. Looking for housing was learning. Affordable housing, real definition, is rent that is a percentage of market rate. I didn't qualify. Public housing, income-based housing, which I qualified for, section 8, I thought I would bring that up. More affordable housing at a percentage isn't addressing poverty, but it makes politicians feel good," end quote. And so it seems as we're talking about housing and permanent housing and the plan moving forward and not getting us stuck in a clog of shelters without a plan for housing, that I think that question still remains on what we're going to do about section 5.
I don't know that I have a specific answer for that beyond.
Neither do I, except for we should build deeply affordable housing.
Yes, absolutely.
It's hard too. I mean, I talk with community members about the same issue, and it's just hard. People they want to know if they can pay the rent and how much it's going to be. And when we start throwing statistics and percentages and fractions at them, it gets confusing.
Yeah.
And I empathize with that. I think often they mean the rent I was paying 20 years ago in this community, right? And it's not a percentage. So it's unfortunate. I have a general question, and it's around the PIT counts, which is a point in time count, and it's a requirement of HUD and is related to all of the funding. There's been talk or requests in recent years to increase the number of PIT counts. That's for those of you listening, when we go out in the community at a particular point in time and with a group of volunteers comb the streets and look for folks and count them and ask them questions so that we get an actual number, and then those numbers are fed into all of these studies. So there's been discussion about doing it more often, thinking that January, the last week in January, isn't maybe the only time that we would see that trend. Is there any progress on that? Did the NAEH study, suggest anything around that, or do we have any recommendations around that? Does anyone know?
I'll let Emily take that question.
Can you hear me?
Yes.
Okay. They did not recommend an additional point in time count, but what they did recommend is that we globally improve our data. So that's related to strategy number 4 and all the work that Charles has been doing with providers. The point in time count is really important data for us, and it gives us good comparative data year after year, but it's also really limited because we know that our shelter and transitional housing data during the point in time count should be very, very accurate. We know there's no chance our unsheltered count is ever going to be 100% accurate. It's just not possible to ensure that we connect with every person who's unsheltered. We want to do an increasingly good job at that. We want to have better and better planning and methodology every year. But it's never going to be as accurate as good ongoing data collection from day shelters like A-Hope and from outreach providers, from folks who are having those touch points with people who are unsheltered. So the Alliance overall recommended that we really double down on investing in our overall data collection. Our next point in time count is coming up January 30th, and we, as you mentioned, there has been ongoing discussion about the opportunity to do an additional point in time count. I think that does make sense for us, maybe a summer count. You know, we feel like our population has some fluctuation over the course of the year, but we don't actually know because we don't actually have that data at this point. But I hope that that's the kind of question that the System Performance Committee and the new continuum of care structure will be looking at.
Okay. And one little follow-up to that. Thank you, Emily. So the HMIS, the Homeless Management Information System, I heard in the community that there are some partners that are involved in providing shelter but do not use the HMIS system. And that's been complicated, right? So the recommendation is to get everyone into the same database and system. Are we looking at providing assistance in any way or software in any way that allows them to start joining us in that data collection?
Yep, great question. So currently what we do is we use one of the continuum of care grants. So part of that $2 million in federal funding is how this community for a long time has funded HMIS across the community, meaning providers that participate don't have any cost for using that data system. In other communities, that's distributed across providers. In our community, we consolidate that cost. So we do have the resources and infrastructure to make that available to folks who are conducting data collection with people who are unsheltered. We have had with people who are homeless, including shelters and transitional housing. We have had a good increase in participation in HMIS over the past few years, and we certainly still have more work to do, but I think we're getting better and better data as we go along. Thank you. Any other questions? I'm going to turn it back over to the mayor. Thank you.
Thanks, Lacey.
I'm turning it to you.
All right, this is our last section. You made it. You guys have done great. Thank you so much for your time and attention this morning. I just want to wrap us up with a few sort of global themes from our conversation today. Some lessons learned from the last 10 months of seeking to implement the recommendations from the Alliance. Number one, our community is ready to act. You know, I said this in the beginning, but we've had such widespread engagement and participation, people being really willing to invest time and energy and effort into taking action to implement these recommendations. And as you've heard throughout today, no one can do this alone. We have to have that community-wide investment and energy. And I really have seen that from our community since the Alliance recommendations were delivered. Secondly, the importance of collaborative planning and implementation results in shared ownership and accountability. It's very important to be clear and transparent, important to be strategic about who gets a seat at the table and how and what that means, and to make sure that we have a number of tables, but that those are all working together, that they're coordinated and moving in a common direction. Also, standing up a new continuum of care will take time, and will be worth the investment. I think it is the highest impact thing that we can do for long-term returns on homelessness in our community, is to build that effective ecosystem of homelessness response. And this is not a one-time action. The continuum of care should evolve continually as the needs in our community evolve. So some next steps on the continuum of care. We have just begun the membership drive, as Lance talked about, just begun that membership drive to build the continuum of care membership body that will sort of initiate this new phase of planning work in our community. We have individual and organizational forms available here today and on the Homeless Strategy Division website. Those forms include the opportunity to provide feedback on the charter. We want, as I've said, this is a participatory planning body, and so we want people who are going to participate in this process to have the opportunity to inform what that charter should look like. Members will be invited to orientation, followed by the first full membership meeting in early 2024 to adopt the charter. And then past that point, there will be a second full membership meeting to vote on seating the board. And then the board will begin with some continuum of care training. We'll set strategy and priorities, and we'll appoint committees later in 2024. And then we go. So once we have that structure established, then we'll be able to really dig into all of that work. Next steps for our community, for folks who are here today. Again, Lance said this, I can't encourage you enough to become a member of the continuum of care. This is evolutionary and will only be successful as our collective participation in it. There's no they, there's no such thing as someone else who's coming to rescue our community from homelessness. It really will take all of us. This is a highly participatory process. We need every stakeholder in our community to participate. How fast and how far we can go will really depend on the level and the quality of engagement that we see across stakeholders. So that, again, includes the city and county, but is not at all limited to the city and county. And then I'm happy to tell you that we have some folks from the nominating and membership committee who've been really working very hard on this process. For a number of months, we have some folks from that committee who are here today. They'll be available for a conversation, and with membership forms, there's a table set up in that room. We'll have our staff there as well. So I would encourage you all to stop by there and ask questions and get those materials and really engage in that process. And then next steps for the city and the county, to participate in the continuum of care, to engage as liaisons, to invest leadership in the board, to make staff available to serve on committees and work groups, and to help engage other decision makers and partner systems of care. One of the points in the New York Times article about Houston recently talked about the importance of using political capital to engage partners to participate in this collective planning process. So would certainly encourage that so that we can really bring all of our partners to that common table. And then lastly, to continue to invest in the continuum of care, to provide additional and ongoing resources. To your question about the cost of rapid rehousing, I looked that up in the report. The Alliance recommended $3.4 million a year in rapid rehousing alone. So this is a costly endeavor if we do it right. So we'll certainly continue to require new resources and ongoing resources to sustain an effort to respond to homelessness. And that includes staff to develop and maintain an infrastructure. I want to say thank you to City Council and to County Commissioners for expanding staff capacity in the past year. Really makes a significant difference for us to have the human resources to be able to engage our partners in this effort. Overall key takeaways. For me, the Alliance project really provided very clear direction for our community and has mobilized a number of stakeholders across sectors. I do think that we have accomplished a lot in the past 10 months, and we also know that implementation will be ongoing under the leadership of the new continuum of care. The goal, again, is to build, sustain, and continually evolve a collaborative and effective ecosystem of homelessness response. And you all are key stakeholders. The city and county are key stakeholders, but effective response will take widespread participation and coordinated action throughout our entire continuum of care. Happy to answer any questions, and thank you again so much for your time and attention today.
Thanks, Emily. I do have one question on the question about the stipend for the folks who would serve on the new continuum of care who don't work for an organization where they're paid to do that. So it sounds like everyone's in agreement with that idea, but there just needs to be a source of funds identified to do that. So what are the options on that? Does continuum of care have potential resources to do that, or is that a request that needs to come to the city and or county? Just like, how does that get resolved?
I don't know. Probably both is the answer. I mean, how I would anticipate this flowing is again, staff are making drafting some suggestions, but I would think that a committee of the new continuum of care will make a recommendation to the board with an identified framework, meaning is it hourly, monthly, is it a salary, is it a stipend, is it in kind, is it there are a number of considerations to developing that framework. That the board would adopt a framework and then would identify at that point the resources needed and what some possible sources of that might be. Certainly possible that the board would approach the city or county and ask for some support in that.
Mm-hmm. Is there any concern about, I mean, that all sounds good, but although if you're recruiting new folks to join this, right, like knowing what that policy is might affect like folks who want to serve on it, right? So it seems like it would be an issue that would be desirable to resolve, as this is kind of being rebooted.
Yes.
I agree, Brownie, I agree, and thank you for asking that question. I also worry if we don't come up with at least a recommendation, then we might lose the folks with lived experience who've already been participating.
Can we ask the COC subcommittee to give us a recommendation? There are already some committees that exist that do have funding for membership, and obviously there's models around the country for COCs. And it is a committee that does have a number of people who are essentially being paid to do their job, and part of their job would be to be a part of this. So, you know, some delineation between those with lived experience, that makes sense. But if they want to make a recommendation so that we can put that in place for purposes of recruiting membership ahead of time, that would be, I assume, not objectionable to the bodies.
So if we can be of help in, you know, resolving that, I think we'd bring a very open mind to that.
Yeah, I appreciate that. I appreciate I hear a clear understanding of the importance of that and the value of including folks with lived experience in the process.
A question I have. If the city and county, we are key parts of this, you're using our staffs and all, why is it that the representative from the council and the representative from the commission are not full voting members?
Great question. In the conversation that we had with both the Alliance and our technical assistance provider from HUD, their very strong recommendation was to be sure that you have that well-established relationship and clear opportunity to communicate with elected bodies, but they recommended not having those representatives serve in a voting capacity because of the inherent power differential. So wanting to be sure that we're really creating a very level playing field at the Continuum of Care board level. They've mentioned that in other communities, they've seen people at the board sort of defer to politicians when politicians are sitting at that table in that same way. And one of the community values that they identified and that Hayek has adopted is that politics will not drive policies. And so I think the recommendation from the Alliance, from our HUD TA provider, and that was adopted by the governance work group was to be sure that those relationships do exist with voting, with elected bodies, but that they not be voting members.
But as long as the politicians are controlling the money, that's going to be a problem.
Well, I think part of what is true is that the city and county are both key funders in homelessness response, and there are a number of other key funders in homelessness response, including the federal government, but a number of other key funders. If you look at the total landscape of how much our community is spending on homelessness, the city and county portion is just a portion, and it's a key portion. I don't want to take away from that, but it's just a portion of the overall spending on homelessness response, which is back to the intention with the Continuum of Care to bring all of those funders, all those folks together so that we're strategic in how we do that and are really making those decisions together.
Is there a pie chart somewhere of all those revenues and inputs into homelessness and what portions, which?
No, but that was one of the recommendations that we got from the Alliance. It's one of those 112 action steps, and I anticipate that'll be an early activity for the funding committee in the new Continuum of Care to do that resource mapping across the community. Thank you. I think that is part of our challenge right now is we're not clear who's paying for what and how much are we spending and is it working? You know, part of our opportunity is to understand that landscape.
So, did you go ahead? I'll ask my question after you. No, I don't have a question. I was going to when it's time to wrap up, we'll wrap up.
Emily, you provided an anecdote this morning that stuck with me. Basically that communities like ours are a little less organized, more disjointed, and it impacts unhoused person's ability to access services. And you gave the example of Houston where they have a COC that operates in some sort of better manner. I totally accept and believe in that premise, of course. I guess, can you give me an example of what that should look like? What do you think that I and we, the royal we, should look for to be able to tell that we're on the road to more organized success with this new COC?
I think, I mean, I could answer that 100 different ways, but I think one piece is that if someone who's homeless approaches you and says, I need help, how do I get help? Do you have a good answer? I don't. I have to really dig into what their particular situation is and then think about my own knowledge base and figure out if I can call someone, how can I point them in the right direction? Well, that's terrible. That's very inefficient. It's very ineffective. So I think an easy barometer is, do we have a clear answer to that? And then when people get connected to services, does it work? Are they able to then get matched with the resource that they need based on their particular situation? Or are they coming back to you and saying, I called that number, but they never called me back, or whatever the case may be? That's one thing. And the second thing I think is we don't have great baseline data outside of the point in time count, but as we build our data and as we have this system performance committee that's really critically evaluating what is and isn't working in our community, we should be able to see progress in a very tangible way over time.
Fantastic, thank you.
While we're all here together, I'm just thinking about the Thrive Report and the racial disparities that it shows from the housing that we are building. And I wonder what it looks like for us to coordinate. My colleagues have brought forward ideas for like voucher set-asides. Our Human Relations Commission for the City of Asheville recommended that we add to our inclusive protections against discrimination a source of income protection, at least to start to document the known discrimination in our community when folks are trying to pay with veteran vouchers, Section 8 vouchers, child support. So it does seem like there's some things we could do as the city and the county together to coordinate our future building of the affordable housing that we need. And the second thing, I just got to shout out to the membership application. We talked a lot about getting our neighborhoods involved. Our neighbors without access to housing and health care are experiencing serious quality of life issues. And the way that we're dealing with it now, like having 90 of the charges of our special operations for the city resulting in nonviolent crimes like panhandling and trespassing, ties up a lot of resources. And so I'm thinking about our plans for housing moving forward and how we get everyone at the table. We have talked about getting the Coalition of Asheville Neighborhoods involved. But I think between the city and the county, we could also do some more outreach to make sure we get the county neighborhoods involved too in solutions that move our dollars, our budgets, plans, and policies to match our values and our adopted goals. So today is a great day to reach out to your networks and ask folks to apply for the COC.
Hey, Emily, I've got one other kind of process question. So thinking about thinking forward to the newly constituted continuum of care, right, where this is going to be sort of this key, right, sort of funnel through which all these issues and deliberations, strategizing around what to do to address homelessness in the community will be flowing through, right? So Christina, the county, and I'm sure the city, gets lots of separate requests for different things to projects to support, programs to support that are homelessness or related kind of projects. So in the, once this is established, is it correct to think that in the future, as there are different projects and programs that people want to do, that we should really encourage all these different groups to basically go to the continuum of care first, right? Like this is going to be the place where these ideas get vetted to make recommendations out for, even if we put in more resources, we'll still live in a world of finite resources, right? And our job is to make sure we invest them to have the highest impact. So that if, in the future, if there are recommendations on different kinds of projects or programs, we will be able to look to the continuum of care for basically recommendations on what are the priorities in this space for the investment of our resources each year.
Very well said. Exactly right. Exactly right.
All right. Good.
There you go. Your work here is that, no. Emily, we want to thank you and Lacey and everybody for all your work and your team's work. We really are in a different place than we were January 2023. The county has created this incredible group staff to be able to work with us, and we've grown our staff support, and you guys are such a dedicated team and have such a a rich history to bring to your work here, so we're really benefiting from that. So that's great. And we have super awesome supportive managers, so great work. Now it's our job to be supportive and continue to get behind all the initiatives. So I just wanted to just say a couple of words and wrap up. Just to reiterate again, the City Council has voted unanimously to support the implementation of the National Alliance to End Homelessness recommendations, of which there are 9. How many did you keep saying? 112. So we have made a lot of progress, but I think what was clear to everyone today listening to these presentations and all of the guest speakers who spoke with us today is that this is truly a community effort. It is a collaborative effort, and it's getting much more efficient and effective and needs to continue to do so. We have good and bad here. We have a challenge in our community that is tough for us. But the good news is we have so many folks here that want to do this work. We have so many community partners, nonprofits and faith-based institutions, all kinds of folks that are here wanting to do good. We just need to help coordinate everyone and make us the most effective we can be. So one big takeaway here is the new COC governance structure is a big deal, and we should see a further momentum from that change. And the other that we heard here is we need to do more, and we have before us a proposal that is getting gelled up now that we'll see in early 2024 around a low barrier shelter with a lot of services embedded within that facility that will serve our entire community. And that's a big deal for us. And we did see one example from Flagstaff that's a great example for us, but we've been studying ones all around the nation. So a lot of communities have these and variations. So time for us to look seriously at that.
All right, thanks, thanks, Mayor. And also just thanks to everyone again who brought us together today. It is encouraging to see that there's been very real progress made, very substantive progress made since we were here not that long ago. So, but obviously there's much to do, and but we now have a really clear and specific plan to help guide that path forward. So that's exciting. I think I speak for all the commissioners when I also shared, we're excited to see the plans coming into place that are going to provide safe shelter over the next, this coming year for folks who need it in our community, and maintaining what we have and expanding that. That's going to provide a real impact for a lot of individuals and families right now. So appreciate everyone's work to make that happen. And even more importantly is coming up with the more permanent plan for how to expand that out and provide a permanent new low barrier shelter in our community that is going to benefit us so much. So I know we're excited to see specific ideas come forward for how to make that happen. I want to give a shout out to Jasmine representing the county commissioners on working to develop the interim plan, as well as doing a lot of great work to think about the more permanent facility. The commission has reserved some of our last unallocated ARPA funds specifically for this purpose, because we knew that this was going to be coming forward, and we think it's a critical path, piece of infrastructure for our community. So thanks in advance for all the folks who will continue to work on coming up with like the best specific strategies to take that idea and make it a reality in our community. So thank you all again for coming together today and taking the morning to do this. We know everyone's really busy, but we appreciate all of you and all the partners that we work with to address these key issues. So
the bells are still chiming, so we're right around 12-ish. All right, we are adjourned.